which I'm going to discuss today is lasers and periodontal therapy. I'm going to critically review. It's not only going to be a lecture, it's going to be a critical review on lasers. So this is my institution, this is my alma mater, Rajamota Dental College and Government Dental College in India. So lasers have revolutionized dental practice in the last few decades. Since its introduction in 1960s, laser is one of the most captivating technologies in dental practice and used for various treatment procedures like caries removal, bleaching, treating dental hypersensitivities, or various kinds of surgeries. So this less invasive and bladeless technique is bringing out a lot of successful outcomes in a variety of periodontal treatment procedures as well. Periodontal disease, as you all know, is an inflammatory condition of the supporting structures of the teeth caused by a variety of periodontal microorganisms. Though there are various conventional, non-surgical as well as surgical treatment procedures to treat this disease, they have certain inherent limitations. Hence, lasers are nowadays emerging as an alternative or as an adjunctive tool to the conventional mechanical treatment methods. There are various clinical trials and literature saying that lasers are highly successful in treating periodontal disease, but always remember they also have potential disadvantages. Hence, the aim of a presentation is going to demystify the real benefits as well as the potential drawbacks of various kinds of lasers in treating periodontal diseases. So this is the acronym, as you all know, light amplification by stimulated emission of radiation, and they have the specific properties. This laser light has got specific properties like monochromatic, coherent, collimated radiation, and perhaps they are very directional. And based on the active medium, they can be classified as gas, solid, or liquid lasers. So these are the various clinical applications of lasers and periodontics. They can be used for non-surgical therapy, frenectomy, gingivectomy, depigmentation, to osseous recontouring, and also to treat periimplantitis, and perhaps also can be used for crown lengthening procedures. So why lasers? Because compared to conventional methods, lasers cause very less bleeding during the surgery, and the patient comfort is very high because the patients will experience very less pain, and most of the times they say that local anesthetic may not be required. So these are the various lasers used for periodontal or dental surgical procedures. It can be a diode laser, neodymium yttrium YAG lasers, erbium YAG lasers, erbium chromium YSDG lasers, CO2 lasers, or orgone lasers at different wavelengths. So now, why lasers are really beneficial or whether they are a hype, we have to see. So application of lasers and periodontal therapy are a little bit complicated because periodontium, as you all know, consists of both soft as well as hard tissues. So we need to have an equipment that works best on both soft tissues as well as hard tissues, or at least not being detrimental to either of the tissues. So non-surgical periodontal therapy is primarily aimed to remove the plaque and calculus and also to reduce the bacterial load and inflammation. So the conventional therapy, as I told in the previous slides, has got a very good success, but they also have certain limitations because it's very difficult to reach inaccessible areas like furcations. So in these areas, I think lasers are playing a very, very good role. So coming to calculus removal, most of the lasers, they remove the calculus by melting or by carbonization. SRP always is a gold standard. Scaling and root planing cannot be replaced. It's a gold standard. So lasers can be used only as an adjunct to conventional SRP and not as monotherapy. Lasers can also be less time consuming compared to your manual instrumentation or ultrasonic instrumentation. So Nd:YAG laser, they have said, is very, very good in removing the subgingival calculus because the subgingival calculus has got a dark color because of the pigments. So this dark color absorbs this Nd:YAG laser better. So they say Nd:YAG laser at 1.5 or 3 watts, 15 hertz power at 45-degree inclination to the root surface is very good in melting or carbonizing the calculus present on the root surface. So subgingivially, the erbium YOG lasers are considered as very, very effective in removing the calculus without producing much thermal changes to the adjacent structures. Both erbium YOG as well as erbium, chromium, yttrium, scandium, gallium, and garnet lasers at different wavelengths have shown supreme efficacy in calculus removal as well as reduction in the probing pocket depth. So what are the limitations? There are also some conflicting reports by Sung et al. They said melting of calculus and thermal damage to cementum have been reported with the use of Nd:YOG lasers. And Cobb et al. Have studied with Nd:YOG laser, and they found that these lasers are not that effective and only patchy in removal of calculus. So root detoxification is one more important aspect of periodontal treatment, because exposed root surfaces are always contaminated with plaque and the bacterial biofilm. So this biofilm and the endotoxins have to be completely removed from the root surface to enhance new attachment or attachment of cells. So root detoxification can be performed by using different lasers, like CO2 laser in a defocus mode is very good. They remove the endotoxins and provide space for new fibroblast attachment. Similarly, Nd:YOG laser also inactivates the endotoxin from the root surfaces. But the erbium YOG laser shows the highest bactericidal effect against periodontopathic bacteria, even at low energy levels. And they also produce very less thermal changes. The erbium YOG has been found to be supreme lasers in removing the root surface endotoxins. So there are also certain limitations. By study by Liu et al., they explored the effectiveness of Nd:YOG laser, and they found that Nd:YOG laser has not completely removed the endotoxin. They even measured interleukin levels, and they said that Nd:YOG laser has not completely removed the diseased cementum or the root toxins. So we recently did a study by using erbium YOG laser and found that this laser was superior to ultrasonic scalers in removing the calculus, and also they removed less amount of tooth substance compared to Nd:YOG or compared to ultrasonic scaling instruments. And we are yet to publish this study. It's about to be published. There is a famous protocol called LANAP, or laser new attachment procedure. So one of the main objectives is we have to remove the lining of the periodontal pocket epithelium, because this lining contains granulation tissue, infected granulation tissue, as well as various ulcerated areas that prevent the reattachment of cells. So conventional methods are always there, but there are certain limitations. So we are now using lasers. So Nd:YOG laser at various power settings is safe for removing the pocket epithelium. Especially these lasers are now coming with a fiber optical handpieces. Flexible fibers are there, so they can precisely deliver this laser energy into deep periodontal pockets. So as per the protocol, if you use the laser, you can achieve a very good result. The Nd:YOG laser has to be used in 2 passes. The first pass at 4 watts energy at 20 hertz should be applied to deepithelialize the circular epithelium. Then the teeth should be again scaled with power scalers, and then a second pass at 650 microseconds pulse duration at 20 hertz will stabilize the blood clot. So this is the protocol for LANAP. So clinical trials have seen that laser-assisted new attachment procedure can cause new cementum formation and periodontal regeneration in a previously diseased root surfaces. So these are all landmark studies by Yukna et al. And Schwartz et al. Then there is a laser photodynamic therapy, which is coming up very well now. Photodynamic therapy is nothing but inactivation of the microorganisms using a sensitizing dye and a specific laser light. So this is a very, very good method of deactivating the microorganisms. So exact mechanism is this laser light and the sensitizing dye, they destroy the bacterial DNA of cytoplasmic membrane. So the membrane transport system is affected and also inhibits the bacterial plasma membrane enzyme activity. So antimicrobial photodynamic therapy seems to be an attractive option and also non-invasive as well as cost-effective procedure for treating periodontal disease. So the major reason for using PDT is to effect reductions in subgingival bacteria, but the only conflicting aspect is only very few published clinical trials have really measured this parameter of whether the subgingival bacteria is really reduced. So that is the limitation here. We don't have much reports. We have published one of our studies using this laser and photodynamic therapy in international journal. And in this study, we found out that the photodynamic therapy not only effectively reduced the subgingival bacteria, but also there was improvement in clinical and biochemical parameters compared to the conventional methods. So in addition to non-surgical procedures, various surgeries can be done using lasers, gingivectomy, frenectomy, operculectomy, depigmentation, osseous surgeries, and peri-implant surgery. And already I told you about the advantages. So this is a laser gingivectomy. It is done with a diode laser in a contact mode. So it's cleanly reshapes and resects the gingiva. So carbon dioxide lasers, they cause rapid vaporization with a very good chemostasis, and they're very good for gingivectomy, especially when there is a bulky gingival overgrowth. Carbon dioxide laser is very, very handy. But only thing is caution should be exercised because it produces a lot of thermal changes. Similarly, NdOG lasers and diode lasers can also be used for gingivectomies. I do use a lot of gingivectomy procedures by diode lasers, but again, there is a lot of thermal changes that has to be managed and precautionary measures has to be taken. So erbium YOG lasers are considered very safe for soft tissue gingival procedures because they produce a very good deep penetration as well as cutting and reshaping the gingival tissue without much thermal changes. So depigmentation is another very good aspect. Patients are very happy with using lasers for depigmenting or removing the melanin pigmentation. We are using diode lasers as well as the erbium YOG lasers. Both are very good. NdOG, erbium YOG, and diode all are very good in depigmentation procedures. And also the recurrence rate, they say, is very less when you use lasers compared to scalpels or other methods. So osseous surgery has to be performed with a lot of caution because we are removing bone or reshaping the bone. NdOG laser and erbium YOG laser have been very much used for osseous reshaping. Erbium YOG at 2940 nm wavelength or erbium, yttrium, scandium, gallium, garnet lasers at 2790 nm wavelength are very, very useful for osseous recontouring. Osseous recontouring is always a part of periodontal procedure because we have to create a physiologic bone contour so that the overlying gingiva will also follow that physiologic contour and recurrence of pockets are always prevented. So to treat peri-implantitis, diode laser irradiation has been proved very safe because it does not cause much surface characteristic alterations in the titanium implants when you compare with NdOG lasers. So some literature says that NdOG and erbium YOG lasers can produce damage to the surface properties of titanium implants. So they have to be used with caution. So there are other literatures say that if erbium YOG lasers are properly used at proper power settings with continuous water spray, it produces very, very less thermal changes and causes less surface alterations in the titanium implants. So as per the systematic reviews, I think erbium YOG laser is very, very useful. American Academy of Periodontology concluded that the erbium YOG laser demonstrated the best application of laser and can be used directly in the tissues, leaving the least thermal damage and creating surface changes. And this suggests a very good biocompatible for soft tissue attachment. So there are also certain advances in lasers by you can use water lace that uses energized water to cut and coagulate the soft and core tissues. And now PerioWave is coming up very well. It uses non-toxic dye and works on the principle of photodynamic disinfection. And there are also lasers available for caries detection. So these are all the advances in lasers. So as the time is very less, I would like to conclude saying that lasers are definitely a very good, effective tool in treating periodontal disease, but always remember a point that they should not be used as a monotherapy because SRP is always a gold standard. So laser should be always used as an adjunct or only aside with your conventional treatment procedures, and always the safety precautions should be followed, and proper operating protocols and principles should be followed by the operators. If you follow all these protocols, you can have a definitely successful treatment outcomes using lasers. So with this, I would like to thank everyone. Thanks for all the audience for patient listening. Thank you very much. Thank you. Any questions are welcome.